Okay, so let's look at this. Finally, we're in more of medicine stuff. And the body is a complicated organ. We talked about this a little bit. It takes a lot to balance it. Homeostasis, right? To balance everything, to keep everything in proper working order. The body is always trying to balance things. Keep everything in order. We take for granted a lot. And again, you know, it's probably just, you just don't think about it, right? But you're not thinking about breathing right now, correct? Nobody has to think about breathing. It's automatic, autonomic. The body doesn't request we can hold our breaths, but not for very long, right? So we do have some control over it, but we don't think about it. After, I don't know, some time in here, you're going to think about breathing a little bit, because you're going to realize how complicated it is. It's very complicated. A lot of systems have to work together in order for us to take a breath. Right? Same way with heartbeat. It has to time. It has perfect timing. I'm telling you, it's complicated. You'll see that. And you might reflect back and go, wow, that is a complicated thing in order to get that heart to go boom, boom. But we just take these things for granted, okay? But and it's not. There's a lot of medical terms. You have to know the terminology. All right? If I'm learning a foreign language, which medicine is a foreign language, it's a new language, you have to know that language, right? Let's say I wanted to learn Spanish, right? I would have to learn the terms, correct? To speak Spanish, to understand it, to read it, I'd have to learn the words. Same thing. If you're going to understand this, you have to learn the words. And unfortunately, sometimes there's multiple words for the same thing. So you sort of have to memorize 2 or 3 things. Just like sort of like English, there's multiple meanings for the same word. Okay? Let's look at this right quick.
Even though medical terminology is easier to learn once you understand word parts, learning those word parts can still seem like a daunting task. But there's a way to make learning both word parts and terms easier through the use of mnemonics and memory systems. Mnemonics are simply memory aids, little things that help you remember new material. You've probably heard the rhyme, in 1492, Columbus sailed the ocean blue. That's a mnemonic. Rhymes are one kind of mnemonic, so are acronyms. An acronym is a word formed from the initial letters of the major parts of a compound term. For instance, school children have been taught for decades the name Roy G. Biv as a way to remember the colors of the rainbow: red, orange, yellow, green, blue, indigo, and violet. Roy G. Biv. Or you might use the acronym HOMES to remember the names of the Great Lakes: Huron, Ontario, Michigan, Erie, Superior. There are other sorts of mnemonics. Musicians learn the phrase, "Every good boy does fine." Just remember the lines on a musical staff: E, G, B, D, F. But inventing rhymes and acronyms is neither fast nor simple. The easiest and most flexible way to memorize new material is with a memory system. A basic memory system takes only minutes to learn, and it can be applied to any kind of information: lists, names, mathematics, foreign languages, and medical terms and word parts. All memory systems are based on the fact that it's easy to remember something new when you associate it with something you already know. But it's not enough to just think, I'll remember to buy bacon because I already remembered to buy eggs. That's not a strong, memorable association. The trick is to use an exaggerated or nonsensical association. And you have to take a few seconds to really see that exaggerated or nonsensical image in your head. That's it. Let's demonstrate this with some of the terms from our list. The suffix rexus means rupture. The word part rexus sounds like rexus, as in several Tyrannosauri rex. So do it now. Close your eyes. For just a few seconds and picture yourself struggling to lift up a couple of T-Rexes and yelling, "Ow!" as you give yourself an abdominal hernia. Really see it. Give yourself a few seconds to see that picture. Yes, it sounds silly. That's the key. If it wasn't silly, it wouldn't be memorable. If it was an ordinary, everyday image, you forget it in the flood of ordinary images you see every hour of every day. Now that you've fixed that ridiculous image in your mind, you'll probably have a hard time not seeing yourself lifting up a couple of T-Rexes when you see or hear the suffix rexes. Here's another. Sclerosis. It means abnormal hardening. Sclerosis sounds like scholar. Imagine a scholar. Maybe somebody with a cap and gown, for instance, or a stack of books, studying. And this scholar is studying so long and so hard that she's fossilized. She's hardened into stone. Now close your eyes and picture that scholar hardening into a fossil. Concentrate for a few seconds. See it. Maybe other people are stopping to look at the scholar. Maybe they knock on it a few times to see if she's still alive. Just be sure to see it, and then open your eyes. If you've actually done it, you'll have a hard time not thinking of a hardened scholar when you hear the word part, sclerosis. Now, what's great about applying this memory system is that the more you use it, the faster and better at it you'll become. The Greeks used memory systems to remember long speeches. Gamblers use memory systems to better their odds at the card table. And if you use a memory system, you can memorize more medical terminology faster and easier than you can without one.
So the one that I used I was taught in paramedic school back in EMT school back in 1992, okay? That's a long time ago. 92. Was you drive your car with your metacarpals, right? And you walk on the tar with your metatarsals. That's one. And there's other ones that I made up that I would trying to think of off the top of my head. What's that one? Hemoptysis. 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 Don't ask me to spell it. But it means coughing up blood. The tis, some way I remembered that by Tyson, Mike Tyson. I think if I get punched by Mike Tyson, I'm going to have my hemoptysis. Because some way that kicked in there that it sounded like Tyson. I don't know. But you get the point. Anyway, you have parts of it. You have the root, this, every time you say that, right? Which means breathing, okay? And then you just combine the words together. Dis, mia. So dis is difficulty, breathing. Tachy would mean what? Fast breathing. Then you have to put a definition. What is fast, right? And we'll do that. 12 to 20 is a normal respiration for an adult. So anything above 20 would be fast per minute. So 24 is a little fast. Okay. So you get these. So you put the words together, and you come up with the tachycardia, a fast heart rate. Again, what's fast? More than what? 20 is pretty slow for heart rate.
Oh, no, that's not.
Okay, so tachycardia. So the normal heart rate is 60 to 100. Just above 100, right? A tachycardia is a heart rate above 100. Sometimes it's abnormal, sometimes it's not. It wouldn't be abnormal in a baby. Their heart rates are supposed to be faster than 100, right? It would be abnormal with us, especially in a resting pulse. Okay. Hemo, blood, thorax, chest. Hemothorax is blood in the chest cavity. So you sort of get it when cardiologist, cardio, heart, ologist, anything with an ist on it is a specialist, right? So you get these combinations and these abbreviations, and we use acronyms and abbreviations. Type in on your on Google, C. diff, and look at the word on it. Somebody do that right quick. Type in C. diff and tell me what it says, because I can't pronounce it. Okay. So CPAP, continuous positive airway pressure. Every time we wanted to say put someone on CPAP, if we had to say continuous positive airway pressure, it would get a little old, right?
It says certified documentation improvement practitioner.
No. C. diff. C dash D-I-F-F.
I heard diff.
Oh, diff.
Okay, it's Clostridium difficile colitis, pseudomonas colitis. Yeah.
You guys have any question now why we call it C. diff?
No.
Right. Who wants to say that every time? Now there are guys out there that would say that. They would say those big words and they would throw those big words around, but you don't, it's that kind of guy. You know, they're trying to impress somebody with their vocabulary. Most everybody will use the abbreviations, okay? Standard abbreviations, we want to use those, DNR, right? Okay, so we'll work on those, we'll work on that, and then the next thing we need to learn is anatomical terms. These terms, these directional terms, you will also hear them as topographic terms, and on top, right? Graph, our body, graphic. So one thing they give us accurate locations of things, okay? Sometimes we don't use them just except in documentation, right? And then, but they're good for locating the organs and organ systems. Keep in mind that the anatomical position is when the patient's facing you and their thumbs are rotated outward. When you're answering a test question and they're asking you the location of the thumb and you say that it's medial, medial would be inward like this. This is not the anatomical position. The thumbs would be what? What direction? Lateral, right? So you would miss that question because you're not aware, or you didn't recall that the anatomical position is the patient facing you with their hands rotated outward, and it's always the patient's left or right when you look at that. So here's this guy in his underwear in the anatomical position, better than him not having clothes on, correct? So we just look at the different parts, the head or the cranium, the thorax or the torso, you know, the thorax. The dividing line of the thorax is the supraglottic notch, which is right here. Everybody feel that notch? Right there, down right there. Supraglottic notch. Once I'm not live, I'll tell you something about that notch, okay, to help you out. So that's the superior border of the thorax. The inferior border of the thorax is the diaphragm or the costal arch. Right? You have the abdomen, the pelvis, and also the upper and lower extremities. Right? So we use those sort of to describe the different sections, and then we have the different planes. Now, the first one, because we reference most everything to the midline, the midline is this imaginary line coming down the center of the body, right? So if you were to draw an imaginary line going down the center of the body, that would be the midline, okay? The next one is medial. Here, medial, definition for medial is towards the midline. So something going towards the midline. And we'll use these in class, so you'll hear them. About this is medial, okay? So if I turn my thumbs in and in that anatomical position, what direction are they going? Medial. Well, they're going medial. Okay, they're going towards the midline. Lateral, lats. It's on the side. Okay, and then of course the right and left of the patient. And then I don't know why everybody has problems with these two, but distal and proximal. Distal, you can think of is away from the trunk, away, and proximal is towards the trunk. When we're talking about a a distal pulse on the upper extremity. The distal pulse would be the radial pulse. Okay? That is distal. So the carpals are distal from the elbow. Okay? The shoulder is proximal to the elbow. So you can work these things out in your head, and you just sort of go through, make up a little song if you want to, right? And you just sort of work these out. Distal is either away from the injury or away from the trunk, and proximal is towards the trunk. Okay, towards. So proximal would be toward the trunk or above what would be considered distal. We would use these a lot. Okay, so you'll get used to the way that we use them. Superior is towards the head. Inferior is towards the bottom. Posterior. You ever heard someone get kicked in the posterior? They get kicked in the posterior's in the back. Okay? Anterior's in the front. Dorsal also means back. Okay, so this is the dorsal part of the hand. Okay, the dorsal part of the bones is foot. The dorsal pedal pulse, right? Okay, so we'll get. I'm not very flexible today. Chips out. Fix that. You have ventral, and you have these other ones. And then I don't really use those very much. I just use the other ones. And then mid-axillary, remember axillary temperature? When you were a wee lad and you wouldn't open your mouth for mom to put the thermometer in, she put it under your arm. Axillary, mid-axillary. It's in the armpit, essentially. Runs down the lateral side from the armpit sort of down to the pelvis. Alright? So mid-axillary line. All these things help direct you to go to find something, okay? And they're really good for documentation. They give accurate descriptions of where the pieces and parts are located. These are the other ones: sagittal, frontal, transverse, and ventral. I want you to go ahead and memorize those because you'll need those with the PCT stuff, and I'll give you later a better picture. I have a better picture of it, okay? But I'll give you that a little bit later on in the class, separate from notes. When we look at the abdomen, okay, the abdomen is divided in 4 quadrants: upper right quadrant, left upper, right lower, left lower. And if you notice here, the belly button is the dividing line. So you put your thumb in your belly button, and everything above the belly button, superior to the belly button, is the upper quadrant. Everything inferior to the belly button is or you could use distal, right, to the belly button, but inferior probably were. The belly button is the lower quadrant. You will need to know what part is in what quadrant when we get there, okay? So just remember that the belly button, what's the medical term for belly button? Umbilicus, right? Umbilical cord, umbilicus, that's where your umbilical cord was attached, right? And then of course the diaphragm being the superior border of it, and then the pelvis being the lower border of the abdominal quadrant. You will need to know what organs are in what quadrant and the function of all the organs. Okay. The next word we look at is supine. Okay, laying on the back, and then prone, the patient laying on their stomach. Okay, so supine on the back, prone on the stomach, and then a recovery position. This is the left lateral recovery position because the patient's on their left side, right? But we would put it's also you would put someone that's unconscious or semi-unconscious, atraumatic, right? Without trauma, in this position in case they vomit or emesis. Have you heard the word emesis?
Yeah.
Don't need to spell it. Is it 2 E's? 2 N? Vomit. Okay, emesis. So if you have a patient that is unconscious, and you would put them in this recovery position in case they have emesis, they won't aspirate or choke on their vomit, right? You have a couple other positions in the bed. Fowler's position. You have a semi-Fowlers and a Fowlers, and this is just at what angle. A semi-Fowler is 45 degrees. So if they won't need you to set the patient up at 45 degrees, they're just going to tell you, go sit the patient up about 45 degrees. Fowler is not really used. They don't use that common term. They just go sit the patient up, put them in about a 45 degree angle. There's certain tests that they have where the patient has to be sitting at a 45 degree angle. So they'll say, go put them in a 45 or go set them up. The term for that is Fowlers. Trendelenburg or / shock position, okay, is not really used anymore. This is the way we used to treat. Now you will see this in the hospital because they haven't given up on doing this. But it hasn't been taught in probably 5 years. Okay, it's not a teaching standard to do Trendelenburg or shock position anymore. We'll get into this more later when we actually talk about shock. But this reduces venous return or preload, and they don't want that. So we don't elevate their legs anymore, even though they still do that in the hospital. They just won't give up. Like administering oxygen to patients that don't need it, they still put oxygen on, and that's for a later day. All right. But to treat this patient for shock, you would keep them warm and give them oxygen. All right. That's how we treat the basic life support. How we would treat. If you don't have oxygen, then you would just keep them warm. This is basic life support. You can do this. You see a person that you think is in shock, keep them warm, and in about 4 weeks you'll learn why. Patho, remember, suffering. We're going to suffer a little bit. Pathophysiology is the way that the body works. The anatomy part of this, the anatomy is just the pieces and parts. The physiology, which I really enjoy teaching, I really enjoy learning how the body works, okay, is the hard part. It's more complicated. The anatomy part is just memorization. Now this is new. Let me see if I can get my mouse over here. Some of you young people figured that mouse problem out. Okay, so that didn't work. That was an epic failure. And I even tested it, but anyhow, look that up on your own. It's pretty cool. Look up human body in numbers, and it'll come up. It's not testable. It's just really cool trivia stuff. Okay. I don't know why that didn't work. This should work for you. Of course, that mouse doesn't.
Yeah.
Finally tonight, keeping boredom out of biology. A Harvard biology professor recently was looking for a way to spice up his course and attract more biology majors. His idea? Get one of America's great animators to make a film showing what's going on in everyone's bodies right now. So what are Harvard students seeing these days? Our Robert Krulwich thought you'd be as fascinated as we were.
This is what a human cell looks like in a textbook, dull and still. But your cells are alive. They're in constant motion. They should be a movie, says Harvard biology professor Robert Liu.
I'm a big movie buff.
And so Professor Liu made a movie, an illustrated but scientifically accurate view of what goes on. For example, let's plunge down here and watch what happens when the cell wants to move something from deep inside the cell to the outside. First, proteins are just floating around, and they suddenly come together to build a road.
But as you can see, they grow from little subunit, little smaller proteins coming together.
And this happens all the time?
It's happening all
So
the time.
the bones grow where they're needed,
Yes.
just like this?
Yes, absolutely. And now this is a more complex fiber.
But it's
called
coming
microtubule.
into being.
Exactly. Here it is falling apart.
And it does this as required.
Yes.
So we're going to create highways or bones of the skin. Oh wait, what is this?
Yes. Now this is a protein called a motor protein.
This isn't real,
That
right?
it is real. That's walking along one of those microtubules.
This clumpy thing?
Yes.
What is it? When
There
it's
it is
dragging
again.
that huge sack?
So it's dragging this membrane sac full of proteins.
This is the stuff we want to get out of the cell. Now, how does it know what direction to go? If I told it turn around, would it be able to?
It can't, because the foot only fits in one direction going one way.
So the grooves are preset to go in one particular direction.
Yes.
And how many of these roads are being built every, second?
Oh, thousands. I mean, there are thousands of these fibers, if not tens of thousands, in every cell. And also,
In your cell, right now, as you're looking all the time.
Right, and they're being built and they're being broken down.
And this is typical cell behavior. Nothing special. There's the cargo being dumped out of the cell. So there you are sitting watching this on TV, and you're thinking, well, I'm pretty much doing nothing. But your 72 trillion cells are a riot of magical, elegant, exquisitely organized activity in you right now. Robert Krulwich, ABC News, New York.
Makes you want to go back and take biology. That is World News for this Tuesday. I'm Charlie Gibson, and I hope you had a good day. For all of us at ABC News, have a good night.
Not really, man. The thing with it is, that's fascinating because of the fact that happens all the time. If you ever get you say, I'm just bored, I need something to do, and you just want to get stupid with it, study proteins. I did that one time. We were talking about these proteins and all that, and I was like, during lunch I'm going to watch these videos over proteins. Oh my, I'll never get that time back. All right, it was so bizarre and so complex. I'm just sitting there going, why did I do this? But it's like a bad movie. You know it's a bad movie, but now you're hooked in it and you can't let go. So yeah, yeah. And so I keep watching it, and that's what I did. I kept watching these videos. And I'm going, I gotta stop this. I really do. And all this information about these proteins, and at the end I'm going, why did I do that? I didn't need to know any of that information, right? But I just got in it, DNA is the same way. DNA is extraordinarily complicated, okay? Extraordinarily complicated. Just like that little guy walking on that could only do that one time. DNA is the same way. There's in the DNA, right? I mean, we can see this. We can see this taking place now. That's how we know it's true. DNA is highly complex. I'm glad I would never have to study it. You guys are going to be in medicine. Welcome to genetics. You're going to have to study DNA, RNA, all that stuff, right? But there's this thing, and he walks over here, and he puts it down here. The exact timing, the exact way, every time. Every time. Or life doesn't exist. Okay? It just doesn't go any further. If this little thing brings this over here and puts this over here instead of here, life doesn't exist. Begin to understand it. I just know we have it, right? And on CSI, they can get it like DNA like in minutes, you know, but in reality, it takes days to actually do DNA. So I don't guess they have days on TV. So maybe that's why. All right. Let me get my hang with me just for a minute.
The transportation of nutrients. Such transportation is facilitated by the endoplasmic reticulum, or ER, which forms in electron micrographs. The ER appears as loose strings running throughout the cytoplasm. These structures are actually delicate membranes. One type, called rough endoplasmic reticulum, appears to be covered with tiny spheres. Rough endoplasmic reticulum extends from the nucleus and is indeed covered with small structures. Rough ER connects to the nucleus and is important in transporting certain substances, such as proteins, into and out of the nucleus. Cells that produce large numbers of proteins have more rough ER than those that produce fewer proteins. It serves as a storage area for newly synthesized molecules. Another type called
Boring part, right? I wasn't kidding when I said boring part. Okay. So, anyway, we'll skip on. This is the picture of the cell, the common cell, and we're not really into cell biology here. We're clinical rotation. There's certain parts of the cell that you need to understand the function of, and we'll talk about those when we get there. But you won't need to memorize all this stuff. I just wanted to show you the picture and the complexity of the cell, okay? Inside the cell of the cardiac cell, and it's amazing on what takes place in that cell. But this cell, we'll talk about different parts of it. The mitochondria, we'll speak of that quite a bit because that's where the citric acid cycle is, or the Krebs cycle, for metabolizing glucose or producing ATP, right? So we will talk about that when we talk about diabetes, and so we'll get into some of this, but some of it we'll leave alone. You'll hit that up in bio if you have to take biology, okay, cell biology. You'll do that, right? However, ATP, that's how we're fueled, right? No ATP. No fuel. No fuel for the car, what happens? No fuel for the body? We don't have life without ATP, okay? The key ingredient to ATP is oxygen and glucose. Have to have oxygen and glucose to produce ATP. We'll learn about that later in the Krebs cycle, all right? Water-based balance. We'll talk about water balance. Some, not a lot, and acid balance, pHs and stuff. We'll speak of that. Carbon dioxide, blood pH. We'll talk about the balance in between those two. Electrolytes. We'll speak of little function with electrolytes. Potassium. Alright? A patient gets their potassium out of order or too high of potassium, it's life-threatening. Sodium, it's life-threatening to have a high sodium level. So water balance, what percent of water are we? 60, 70, depends on what book you read, right? So 60, 70% water. So we have to balance that water. We have to balance the different water in the cells. And of course oxygen. With aerobic metabolism is the normal function, anaerobic is the abnormal because it's without oxygen. So we create waste, carbon dioxide when we breathe, that's a waste product, okay? Poo is a waste product, right? What we eat, drink, and stuff, we get rid of that. We metabolize it. And then, like I said here, oxygen in the cell, glucose. We need oxygen and glucose to produce ATP. Without oxygen and glucose, we produce pyruvic acid, which turns into lactic acid. You're running on the field, and you guys track stars. You're running along, and your muscles start to get cramped up. They get tight, and they hurt. It's because anaerobic metabolism is taking over. You're producing lactic acid in your muscles, and that's where you get the soreness and the pain from. That's for another day, all right? And then the cell membrane wall. We'll talk about this. The permeability of the cell membrane wall. Okay. And we will learn the inside and outside of the cell and how these get out of the cell. Got a lot of stuff ahead of us, right? Some of it's quite a bit down the road. Some of it's next class. Right. Okay. It's a good question.